Good morning, everyone. It's wonderful to see so many people come out so early in the morning for Migrant Health. So thank you all for coming out. I've had a look at the program. Unfortunately, I can't be here all day, but I wish I could because it looks very, very interesting. I'm going to start off today, unfortunately, with some rules and regulations, but I believe this is very, very interesting and also very important, because all of the things that people will speak to you about later will be how to deal with vaccinations, how to deal with TB and specialist issues. But unless we get migrants into primary care to begin with, these issues can't really be accessed. And so that's what I'm going to talk a little bit about this morning. So I apologize already for it being a little bit heavy as a first talk. We'll just see how we go. Just to introduce, already given a wonderful introduction of Project London, so that is what we do. We run a little clinic in Bethnal Green where we see migrants and anyone else who's having a hard time accessing the NHS. We've been running for about 6 years, and in that time I'd say we'd seen about 8,000 patients. We see about 1,500 people a year, mainly from London but also from across the UK. And these are people who are having a hard time accessing the NHS. We provide acute medical care through volunteer doctors, but primarily we do health advocacy, calling around GPs to get people registered so they can get the health that they're entitled to and need within the NHS. Through those 6 years, we've seen some common barriers emerge. Of course, every individual case is different, but the most common barriers that people face trying to access the NHS is lack of knowledge of the system. Having a primary care system where you register with a GP before you're ill is not unique, but it's not common across the world. Language barriers, people who don't speak the language, so we provide interpretations during the medical consultation. At reception, it's often impossible for people to communicate that they want to register. Sometimes people are afraid of being reported. They equate the health system with the immigration system and think that if they have a non-regularized immigration status, that this will be reported to the authorities and they might be at risk. Sometimes care is refused by health professionals, either because there's confusion around the rules or for other reasons. And the main issue that comes up over and over again is lack of documents. Now, we're going to talk about the rules and what documents are actually required so that we can hopefully together eliminate this barrier. But there is today a lot of surgeries that ask for redundant proofs of ID and proofs of address that form an impossible barrier to people to access healthcare. So, what are the rules and regulations? I always like to go back to the NHS Constitution because, well, it's very dear to my heart and I think it's at the core of what we all do, which, again, just to reiterate, that the NHS is set up to provide comprehensive services available to all and based on clinical need and not the individual's ability to pay. So that's just at the core of what the NHS is. Now, I'm sure I don't need to tell anyone here about how the NHS is set up and what the difference between primary and secondary care is. The reason I like to show this slide is because there are very different rules for access to primary care and access to secondary care. And within the health system, I often encounter that the rules for secondary care are being applied to primary care and that there's a bit of confusion about the differences within the system. So keep that in mind as we go through what the rules and regulations are. Now, we're going to start off with the rules for primary care and spend some time on them because that's obviously what is most relevant to everyone here. Thankfully, the rules for access to primary care are very simple. There are no limitations on who can access primary care in the UK. There should be equitable and free access for absolutely everyone. There are no limitations regarding chargeability, regarding eligibility. Everyone should be able to register with a GP. There are no formal requirements for ID documentation. There are no formal requirements for proof of address. Some GPs may choose to ask for these, but not having these documents should not be a reason to refuse registration. Immigration status, or whether or not you're ordinarily resident, a word that is key when it comes to secondary care access, doesn't apply to primary care access. We don't need to worry about that when it comes to registering with GP. There are no legislations that say that you have to be in here for a minimum length of time, you have to have a visa or anything like this. A GP can register, refuse asylum seekers, undocumented migrants, overseas visitors. Everyone can register with a GP. Now, the reasons for this, and the well-documented reasons in the academic literature, is that access to primary care saves money. It catches things early, it prevents diseases, and it saves the public health, which we're going to talk about later. So there's very, very good reasons why everyone should be registered with a GP and why there should be no barriers to accessing or to registering with a GP. The GMS contract says that GPs have discretion to accept or refuse any person as an NHS patient as long as they do not discriminate. The reasons for refusing could be things like the list is full, the person doesn't live in the catchment area. That's about it. Okay, so that's fortunately very simple. Secondary care access, unfortunately, is a little bit less simple. I'm not going to spend a lot of time on this because it actually pertains mainly to those who work within the secondary care sector. But in 2004, this word ordinarily resident was introduced into the system, where people who are overseas visitors are charged for access to healthcare. But importantly, this is about charging. This is about money. It should never be about access. Anyone who needs the healthcare should be given the healthcare. Treatments that are deemed immediately necessary and urgent must be given. However, charges can be made and charges can be pursued within the system. So how does this relate to you as primary care professionals? Often there's confusion about, should I refer this person? What if this person is chargeable? How does that work within the system? What I would say to clinicians is refer with confidence. In the primary care sector, your job is to assess whether or not a person needs this healthcare. So if you deem that they need treatment, you should refer them with treatment and refer them with confidence. Within the secondary sector, there is a whole department of overseas visitors officers whose job it is to make this very, very complicated assessment about whether or not a person is chargeable. To be honest, I get phone calls every day asking me these complicated scenarios saying, well, is this person chargeable? And I wouldn't even hazard a guess because I'm not trained and I'm not qualified to make that kind of assessment. The thing to remember is if it's immediately necessary and urgent, it cannot legally be denied, though it can be charged for. The BMA General Practitioner's Guidelines is not the duty of the GP to establish a patient's entitlement for free NHS secondary care. This is the responsibility of the NHS secondary care provider. You should refer whenever clinically appropriate. So know that and refer with confidence. Just quickly, I'm going to run through how the charging in secondary care works, just so you have a basis to kind of think about this. Secondary care is about who and what is charged for. This is who gets everything for free and what treatment is given free to everyone. I'm going to start with what treatment is free to everyone. Accidents and emergency, obviously. Treatments for sexually transmitted infections, including HIV, since the 1st of October. Treatments for infectious diseases as well. That includes tuberculosis and diseases such as hepatitis, which will be topics later on today. Sectioning under the Mental Health Act, continuing course of treatment if your immigration status has changed. Now, immigration status, this is where it gets very complicated, and this is why overseas visitors officers are specially trained and paid to make these assessments. This is about people's regularized status in the country. If you're an asylum seeker, or indeed even a refused asylum seeker under the care of the state, you get everything for free. Refugees obviously get everything for free. All EEA nationals. There are some limitations on EEA nationals in other parts of the social services and housing benefits and things. This does not apply to the health system. Everyone from the EEA gets everything for free within the health system. There are no limitations on anyone from Eastern Europe or the A8 or A2 countries. Anyone on a dependency visa, anyone on a work visa or a student visa that exceeds 6 months, those from countries with bilateral health agreements, this is a massive, massive area, about 40 different contracts, worth checking out, but they're all individually scripted, and victims of human trafficking if recognized by the Home Office. So these are the people who get everything for free and not charged for anything within the health system, and the kind of treatments that are not charged for anyone. The people who are charged for secondary care are those considered not ordinarily residents, not legally here, not ordinarily residents. So visa overstayers, even if they've been here for 20 years, are not ordinarily residents. Refused asylum seekers living under the radar, not under the support of the government. Irregular entrants are those who come into the country through a lorry or through a fake passport. Tourists being the quintessential overseas visitor, and even people who are here, British citizens who reside abroad. So if you live in another country, you're a resident of that country. When you come back, you're a visitor. That's about all. I know that's pretty heavy for the morning, but what I want to remember is 3 simple things. There are no limitations on who can register with primary care. Secondary care is not about access, but about charging. And the rules around who is chargeable has to do with immigration status and what kind of treatment it is. Now, those are three simple messages. What I also want you to do is to go back to your practices and find out what your registration policy is. Are you asking people for ID documents? Are you asking people for proof of address that can form a barrier to vulnerable migrants accessing healthcare? Then revisit those policies, and there are plenty of references of where you can find. There's a London-wide guidance just gone out. The LMC has just published guidance, and going back to the Department of Health guidelines as well. Lastly, debt is a big problem for people, mentally and physically. Support your patients. Oh, how do we go? Oh, there we go. If you do refer people, refer them with confidence because they have clinical need. When they do come back to you with a large bill from the hospital, it is not the GP's responsibility, but support your patients. Refer them to the Citizens Advice Bureau. Find ways for them to deal with that debt in a constructive way rather than for it to be a mental burden. Right. Any questions?